Hi everybody, welcome back to the Dr. Sia channel and the What's the Diagnosis series. In this video, we're going to be working together with Lisa. Now just heads up, if you haven't watched any of these videos before and you haven't been practicing your diagnostic hypothesis setting, then really make sure that you practice some of the easier videos first, because this one's going to be quite difficult to know what it's like or what it is if you haven't really been practicing your diagnosis. So just a heads up. Anyway, no spoilers, here we go. Lisa, what are the problems you've been having?
Um, well, I've come to you because I've been in this relationship for the last 5 years. Really abusive. I give him everything. Like, look at me. I mean, look at me. Like, I'm gorgeous. And, like, I haven't got a ring on my finger besides my rings. And is there something wrong with me? It seems to be my pattern.
Okay, yeah, there seems like there's some pattern there for you, and you've been in an abusive relationship.
Yes.
And there's some ideas you're having that you're gorgeous and that shouldn't be happening for you.
I'm gorgeous. I mean, look at me. I mean, I work in this industry too. Like, I model a little bit still.
Yeah.
And, you know, everybody wants me.
Yeah.
Yeah. I walk down the street. I go in a room. Like, I can close down streets and rooms when I walk in.
Yeah.
What is wrong with this man?
I'm not entirely sure. And you're seeing a link there between what this man has done to you and how you shut down streets from being gorgeous.
Yes. So what is his problem? Why isn't he just giving me everything and treating me like a princess? I mean, look at me, seriously. Like, can you not feel the loveism between us?
The loveism?
Yeah, loveism. Like, you can feel my chemistry, my energy. Yes?
I'm just wondering that when you say loveism and sort of chemistry between us, do you mean that you're hoping that there's a sense of connection between us here?
Yes, because I can see your cuddle eyes. Like, I can see the loveism and your cuddle eyes. Like, you can feel it, can't you?
When you say feel it, do you mean that you're feeling it inside your body, or more sort of that it's an energy type thing that's outside, that's sort of between us?
Yeah, like outside.
And what do you notice happens inside?
I just know I'm the bomb.
You just know you're the bomb. Okay, when you say the bomb, what do you mean? Like that are you referring to the way you look outside again?
Yes.
Okay.
Yes.
So when you're talking about loveism and sort of spirits and energies between us and so on and so forth, are you referring more to what happens between us as opposed to what happens inside?
Yeah, well, that's where it starts.
Right.
That's what I'm used to.
Right. Yeah, of course.
You know, like I walk in and everyone's like, wow, you look gorgeous.
Right. Yeah.
I've had that since I was like little.
Yeah,
like my uncles, my cousins, everybody just like, they're like, you're gorgeous. My grandparents.
Yeah.
I'm just gorgeous. Like wherever I go, everybody just tells me I'm gorgeous.
Sure. And does it ever not happen that way for you?
Not that I notice.
Okay. All right.
Yeah.
And if it wouldn't happen that way for you, what would that be like?
I don't know. Maybe I would get some work done. Maybe some plastic surgery or something.
Okay.
Maybe something needs to be done.
Okay. And I'm just wondering, has this ever caused any problems for you, this coming into a room and always being the bomb, if you will, and, you know, putting stop to people everywhere? And do you see a link between that and any of the problems that you've been experiencing?
Well, it gives me the attention that I want.
Yeah.
So I guess that's all I really want, because that attention makes me feel good.
Yeah, right. Yeah. And in the past you've been in an abusive relationship.
Yes.
Do you tend to end up in abusive relationships? Or is this just a one-off thing?
No, I guess, yeah. I have a history. I like bad boys, I guess.
Okay. Yeah. What do you mean with a bad boy?
I don't know, you know, they're a bit gorgeous and a bit rough, and everybody wants them, and I usually get them.
Yeah.
Yeah.
And What's it like being here right now? What do you notice happening within you as we're talking about this emotionally? What's it like just talking about you here right now?
Um, I don't know. I've never really had this with a man.
Well, what do you make of that?
I think you're getting a bit too deep.
Okay, yeah. It gets a bit too deep when we talk about you and how you feel inside.
Yeah.
And I noticed that then you're almost looking like you're tearing up a little bit when we're talking about that. Okay, all right. Well, it seems to me that what we're talking about, or what I'm seeing here so far, and what's sort of going on between us. Have you ever heard of something called a bit histrionic? A personality that's a bit histrionic.
No.
Have you ever heard of that?
No.
Okay. So it's basically...
Are you saying I'm old?
No, absolutely not. I'm not saying you're old. No. I'm saying that sometimes when we're a bit histrionic, it's this sense that some part of us wants to keep people very close.
Yes.
Sort of very quickly thinking that we have love and we have closeness. Do you notice that at all in your life?
It's not a problem, is that?
No, I'm not saying that that's a problem in itself. I mean, love is obviously a really good thing.
Yes.
But when it's histrionic, what happens is that it tends to be that we hold people a bit close, but they're not really close enough.
Okay, yeah.
So our relationships end up somehow being, there ends to be a distance between us and the people we're with. Have you ever noticed that?
Yes, I always feel I'm alone.
You always feel lonely. Okay. Even though there's a lot of connection, there's not connection on the deeper level. Yeah. Okay. And then sometimes, obviously, there are some things that just happen and come along with that, like a lot of excessive use of words that probably don't mean a lot of things. I noticed you said before cuddle eyes and love is it.
You do, you have cuddle eyes.
Thank you, that's very nice of you. I'm interpreting that as meaning that you think that I'm actually a kind person.
Yes.
Okay.
Yes.
And that must be quite unusual for you to sit with a kind person who doesn't mean you harm.
Yeah, because, but we do have that loveism between us.
Maybe we can talk about that too, because it seems like there's also some part of you that when it wants to pull people close, that it perhaps does that with your body and with the outside, like you said.
I work very hard. I go to the gym every day.
I imagine, yeah. Then I wonder what it would be like for you, and not to say that that's something that you have to rush into with other men, but maybe I wonder what it would be like for you if you met somebody who loved you for who you are inside.
Wow. Does that happen?
Well, maybe it can. I'm not really sure how often it happens, or I think it does happen for people for sure. Wow. But maybe if we work a little bit more, we can see if we can find that person on the inside.
Are you available?
I'm available, yeah. Okay. Do you think maybe next week would be a good place to meet, or a good time to meet? Yeah.
What about Wednesday? Maybe we could go and have coffee or something.
Maybe what we can do is work here together. I think this will be a better, safer place for you to work with me, where you can make sure, and I can make sure, that you can have really fruitful, loving relationships with men outside.
Okay. I'll bring coffee.
All right. Yeah. All right. So working with Lisa, one of the things that you'll notice was, firstly, how I tried to convey to her, for the sake of this video, that she has histrionic personality or histrionic personality disorder. Now, obviously, this isn't something that I would just do straight up if the person had a personality disorder, but it's for the sake of the educational video, we went ahead that way anyway. I tried to sort of soften it a little bit to show you how sort of you could talk about it if you had to, in a very sort of rushed manner. But if we look at what was actually going on for her, you would see that there was this use of language in a way where it was sort of impressionistic, where she would make up words because they sort of sounded right a bit, which is a classic feature of histrionic personality disorder. The wanting to be in center of attention, the sexually expressive self, the part of her that sort of makes sure that people look on the outside, pay as much attention attention as possible. The fact that she very quickly would use the word love and loveism, you know, this idea of sort of connecting with people. She basically loves anybody that she sees, Lisa, you know, and everyone loves her, that kind of thing. But deep down inside, we saw that there was a really big difference in the sense that all of this is just a personality, a way to make sure that people come close, but perhaps not too close. And as we looked at that, we looked at how she feels inside. She got a bit uncomfortable. She wasn't used to that. And she wasn't used to someone actually showing her interest into who she is as a real person either. Now, there are other features of histrionic personality disorder that we can talk about here as well, that really there's no way to avoid them. Sort of in therapy, she is the center of attention, and very much histrionic personality disorder is very much about that idea that, you know, she is the center of attention. And obviously, so when people do show up to therapy with these histrionic traits or histrionic personality, that's never something that is easily picked up because, well, you know, they are the center of attention in every therapy setting. So that's a little bit tricky. But if you keep an eye on the overly impressionistic use of language, on the sexuality, on this sort of sense of, you know, immediate connection between us and that, you should be on the right path. Now, I hope you really enjoyed this video. I hope you learned a lot from it. And if it was too difficult, make sure that you watch some of the other ones and then maybe come back to this one again and see if you can pick up some of the traits that maybe you missed this time around. I hope you loved it. Please subscribe. Please press the bell button, because then that updates you and lets you know when I post the new videos. Thank you very much. I'll see you next time.